So within the presentation, we mentioned a few of our goals and outcomes, but let's talk about some of the performance indicators that will truly measure success. And one of them is to establish direct community provider appointments for SUD patients at 95% or above. How do we how do we measure this? Well, we can definitely have an established EHRS system that links to a database as nurses document the actual appointment confirmation. Uh, so the next one we can think about is the fact that uh, we really want to prevent that relapse and overdose um, by continuing with treatment into the community. So again, accomplished with informatics, EHRS, standardizing documentation fields, which are specific to the indicator measured during incarceration. Evidence-based care guides are the baseline for all EHRS performance indicators. For example, we can monitor urine toxicology, whether or not patients are being screened, whether or not they're getting the NIDA modified assist, whether or not they're looking into their cravings, which is evaluating how they're doing with their meds and their cognitive behavioral intervention. All of these clinical performance indicators are intended to stabilize the patient, put them into remission before they discharge into the community. Preventing an unstable patient from discharging is our number one goal. Otherwise, as we mentioned before, how can a patient who is not stable enough truly focus on that journey to complete recovery and rehabilitation? The last one is a clinical performance. Um, the clinical performance does encompass within all indicators. It's not just one indicator or two indicators. We're looking at whether or not at the beginning, during incarceration, they're truly being screened, assessed, treated. The medication is appropriate. They're adhering to the medication. All diagnostic studies are being performed. Cognitive behavior intervention is being done at the appropriate hours and follow-ups. It is consistent, and whether or not the patient is progressing positively towards remission. And of course, that would be done during assessments, urine toxicology. We're looking for cravings, we're looking for relapse, we're looking for adherence.